This information could change everything, and it all starts with breathing through the nose. Breathing is our body's most important function, and the ideal way to breathe is in and out through the nose. Over 80% of our population is living with some degree of airway dysfunction, and most don't even realize it. Your provider understands the connection of proper breathing and its impact on each system in the body, and they're specialized in addressing breathing as a means to achieve our maximum health. How does breathing really work? Our airway starts with our nostrils. Air is pulled in and travels above our jaws, down our throat, and into our lungs. Our muscle patterns and anatomy determine whether this pathway functions properly. Nasal breathing is the foundation for overall body health, as the nose is the beginning of our immune system. As we inhale, our nose warms and moistens the air, and tiny hairs help filter out dust and irritants. Inside our sinuses, nitric oxide is developed. This powerful compound is antifungal, antimicrobial, antiviral, and antibacterial at high concentrations. With each inhalation, nitric oxide treats the air before it moves down into our throat and our delicate lungs. Think of it like a turbocharger, opening up blood vessels in our lungs so blood flows more easily and red blood cells can carry more oxygen. This creates less work for the heart, ultimately lowering blood pressure and preventing dangerous clotting. This single mechanism not only protects you from high blood pressure, heart attacks, and strokes, but significantly enhances physical performance and endurance. Nitric oxide's function is so significant that the 1998 Nobel Prize in Medicine was awarded to the 3 doctors who discovered its role in our airways. Exhaling through the nose is just as important as inhaling. A slower nasal exhale keeps gentle pressure in the airway so it stays open longer, giving our lungs more time to load oxygen into our blood. Nasal obstructions exist when something is literally blocking the breathing pathway. When this occurs, it creates a need for us to breathe through our mouths. Imagine air traveling through your nose as if it's a hose. When the hose is straight, air moves freely and we breathe easily. If there is a kink or blockage in the hose, breathing becomes difficult or impossible, and we breathe through our mouth to get the oxygen our bodies require. Each breath through our mouth bypasses this entire protective immune process, and cold, dry, dirty air goes directly into our throat and lungs. This triggers an inflammatory process, and inflammation is the root of disease. So naturally, the body wants to breathe through its nose. When the body experiences a nasal obstruction, a domino effect of compensation begins. We move our heads forward of our spine to open up our airway, to unkink that hose. For each inch our head moves forward, an extra 10 to 12 pounds of stress is added to our neck. The neck isn't meant to hold that much weight, so it passes the load down to the shoulders, spine, hips, knees, ankles, and feet. This creates poor posture from head to toe. When this pattern starts in childhood, it creates a lifetime of compensation and health problems affecting our spine, central nervous system, and reflexes. Every body department is impacted: physical, neurological, emotional, and structural. Mouth breathing also affects how our body processes food and energy. Insulin function is impaired, which promotes food storage instead of energy use. This leads to diabetes, obesity, and metabolic dysfunction. And these ultimately lead to more physical breathing challenges. A vicious cycle is in effect. For pregnant mothers struggling with airway obstruction, the stakes are even higher. The chronic stress, oxygen deprivation, and inflammatory cascade don't just affect the mother, they profoundly impact the developing baby. Maternal airway dysfunction is associated with lower cognitive scores in children, lasting far beyond their school years. What began as a breathing problem for the mother can set the stage for a lifetime of challenges for the child. Symptoms to look out for are bedwetting, night terrors, behavioral and learning challenges, asthma or attention disorders, frequent ear infections, and hearing loss. Airway obstructions also impact facial and jaw development in our growing years. Correct tongue swallow patterns ensure ideal jaw expansion and lengthening for tongue space, teeth space, facial symmetry, and brain oxygenation. Nasal breathing encourages proper muscle function and tone to enable lifelong optimal health and mouth resting posture. These are a handful of the physical symptoms experienced by improper breathing, but the invisible consequences are there as well. Mouth breathing affects memory, decision-making, fatigue, symptoms like ADD and ADHD, learning and reasoning, emotional regulation, and overall intellect. Now that we're starting to understand how vital nasal breathing is to overall health, we can finally see the nose for what it truly is, the most important organ in the entire body. While we encourage you to start noticing how you're breathing throughout the day, we know it may not be as simple as just making the choice. There can be real anatomical factors outside your control that make nasal breathing 24/7 impossible. When we are awake and upright against gravity is when the body breathes the best. It's when we lie down horizontally. Our already narrow airways are pulled down by gravity and become even narrower. Our muscles relax and lose tone when we fall asleep, and the fluids in our bodies that are pulled down by gravity during the day now move up to fill the tissues in our head, which narrows our airways even more. If we're overweight, tissue collects around the neck and throat, adding pressure on the airway, making it even more likely to collapse. It's become clear that lying down challenges our breathing, and it's at its worst when we are asleep. Think about it. Snorers don't snore during the day, and people with apnea aren't pausing breaths and gasping. This only happens during sleep. We can have our lips together and still be fighting for airflow because the problem is often in the nose. With any obstruction, a chemical trigger signals the brain, indicating that there's not enough oxygen and too much carbon dioxide. This activates our chewing muscles, causing our lower jaw to move around in an attempt to open the narrowed airways and take in the next breath. The teeth are in the way, so the unconscious mind goes to work to grind them down. You've been told that clenching and grinding is due to stress, and it is, but not like the stress of losing your car keys. This is survival stress of your body trying to stay alive all through the night. Tooth enamel is harder than bone, and our body is grinding it down to keep us breathing. Our bodies give us warning signals, whether it's silent apnea or gasping, once an hour or 90 times, loud snoring or silent mouth breathing, or even mouth closed, clenching and grinding. The message from the body is the same: not enough oxygen. We then shift into survival mode, fight or flight. In that moment, we aren't concerned about tomorrow, 5 years from now, or even 5 minutes from now. We are acting on the need to breathe this instant, no matter the consequences. And while our body is trying to save our lives by grinding, it's ultimately creating more symptoms. If our teeth used to be this tall, and now they're this tall, the space for the tongue gets smaller. The tongue has nowhere else to go but back into airway space in the throat, closing it even more, then more forward head posture during the day and a narrower airway each night. Imagine this cycle all day and night for years. Now, is it a surprise that 73% of people with breathing disorders have TMJ disorders? The grinding pressure also loads the jaw joints, breaking down or dislocating cartilage, and over time, wearing down bone. Airway obstruction causes sleep disorders cause grinding, and grinding causes TMJ disorders. With this 24-hour struggle, when are we actually getting healing, restorative rest? Breathing disorders and pain prevent deep sleep, so during the day, our body and minds are operating as though they've been awake all night. Is it any wonder that we're feeling exhausted, anxious, or irritable? Snoring isn't cute. It's literally the sound of a struggle to stay alive. Our stress hormones, cortisol and adrenaline spike with each challenged breath. This triggers whole body chronic inflammation. And remember, inflammation is the root of disease. The nose is for breathing, the mouth is for talking and eating. Now that we understand how every system in the body is connected to breathing, we are able to address the source instead of just managing symptoms. So how can you tell if this applies to you? Let's start with the many visible indicators. Signs of breathing struggles are often first seen in the face and mouth, such as long, narrow faces and jaws, tired-looking eyes, underdeveloped jaws, scalloped tongue, high, narrow palates, crowded teeth, receding gums, abfraction lesions, erosion, worn, cracked teeth, a sensitive gag reflex, lip ties, tongue ties, tori, cheek biting, red puffy gums, wisdom teeth that won't fit in the arch, or dry chapped lips. Look familiar? These are your body's way of waving a red flag. With specialized imaging, we can now see the obstructions in the entire airway, like narrow nasal valves, enlarged turbinates, deviated septums, concha bullosa, enlarged adenoids and tonsils, and restricted tongue space. The good news is this applies at any age. The sooner you address it, the more you may prevent later, but you're never too young or too old to start breathing properly. Whether you're 3 or 83, addressing airway obstruction is achievable. Earlier intervention often means less invasive treatment options, better long-term outcomes, prevention of secondary complications, reduction of treatment time and cost, and guidance of optimal facial, systemic, and cognitive development. But even as a non-growing adult, there are still many relatively easy ways to address each obstruction. You're in exactly the right place to discover what those are for you. It's never too late. Even if you're not experiencing obvious symptoms, subtle breathing dysfunction may be limiting your potential without you realizing it. Consider what you're losing. Mouth breathing can significantly reduce athletic performance. Nasal breathing, on the other hand, does the opposite. It boosts endurance and physical capacity because it supports nitric oxide. It also defines your posture and balance. When you can breathe through your nose, you're less likely to drift into forward head posture, so you maintain your center of gravity. And at night, your stress hormones can settle down during sleep. That's when your body is meant to restore, ultimately improving muscle tone, function, and coordination. Whether you're a competitive athlete or just want to play with your grandchildren, compromised breathing is limiting your physical potential. The key is a comprehensive evaluation and coordinated care between specialists to address all contributing factors. Be prepared to hear that more than one specialist may be involved in your airway care. There are often multiple body departments that are contributing to your anatomical obstruction. Your airway is only as open as its narrowest point, like a chain is only as strong as its weakest link. So each and every obstruction needs to be addressed. Your provider will evaluate your unique situation and recommend the most appropriate treatment or combination of treatments for you. The goal is simple: to achieve breathing through maximized nasal and throat airways 24 hours a day, 7 days a week. And when you do address these issues properly, everything else becomes easier. Quality of life, health, weight management, and even relationships improve more naturally when you can breathe well, sleep deeply, and restore balance throughout the body. When you arrive for the consultation, you'll be ready to discuss your situation. So make note of questions and connections you made during this video. That way, you and your provider can focus fully on solving your specific airway challenges. Can you see now how your nose could truly be the most important organ in the entire body? Congratulations on beginning the ultimate journey to optimal health.